Okay. Let's see, our numbers are slowing. All right. All right, Betsy, when you're ready, go ahead.
Sure. Is everybody able to see the slides okay? Came through. Fantastic. I never know. You'd think after all this time that we would all know how to screen share, but no, still don't know sometimes. Well, hi to all of you. My name is Betsy King McDonald. I'm the communication manager at the Hope Clinic in Ypsilanti and also in Wayne County. I just wanted to start by saying thank you to all of you, not only for having me today, but also for all the things that you guys do to keep our community fed and housed and healthy and beyond. I know that you guys are always engaged with impactful work, and we appreciate that so very much. Like to also apologize in advance for any pets that wander across the screen because that's another one of those things that tends to happen on calls like these. Um, but it is my joy today to talk to you a little bit about Hope Clinic, what we are up to, what services we offer, and what ways we are able to partner with other organizations like yours to try to make your patients and clients' lives better. So I'll start here on this slide. We're on the south side of Ypsilanti. We're just north of 94 on Harriet Street. And we have been on the south side of Ypsi for over 40 years, providing free medical care to the uninsured and underinsured. It became apparent pretty quickly that folks who were in need of medical care, lacking health insurance, often had other social determinants of health affecting them as well. And food is a big one. Very hard to stay healthy if you are unable to access healthy food. And so, very shortly after our founding as a medical clinic, we also added food as a key component of what we offer. And now we've expanded as well to include dental care as well as fully integrated behavioral health care through all of our programs because we know that people come in as whole people. And a lot of times there will be an upper limit to how much our clinicians are able to help if we are unable to address those additional determinants of health. So it's been an exciting time for us over the past 3 to 5 years, beginning and really blossoming into our process of integration. We've had the privilege of working closely with the University of Michigan on their integration initiatives, and they've been training us to be able to provide that same high quality of service to the people in our community. So we are a free clinic. We do not charge for any of our services. And we are faith-based, but we serve all faiths and none. There is no requirement to be a person of faith or to participate in any activities of a faith variety to receive services here at Hope. We just want to help. And so our motto is to make lives better. So we want to really not just addressing the medical patient or the dental patient or the behavioral health care need, but to see the whole person behind that and be able to, through an integrated approach, be able to offer people the entire menu of services that's available at Hope. So our clinicians are your doctor is talking to your dentist who are on the same site. And your dentist is asking you if you have enough food to make it through the week. And if not, we're helping you get an emergency food bag. We're doing a behavioral health screening to make sure that you have all of your needs met. This is how we are moving forward as an integrated clinic. I'm going to scooch ahead here to the next slide. And all the time for questions at the end. I may not be able to answer all of them, but I'll do my best. And so this is a really quick, very practical rundown. This is on our website of the types of services that Hope offers. I know there's a lot of text, so I know probably we've lost everyone to reading the text. I'll summarize it for you briefly. If you have insurance, health insurance, there's a number of things that services that you can still qualify for at Hope Clinic, including our diaper pantry, our free laundromat, some social services and resource coordination, as well as all of our food programs. You do not have to have any proof of residency, proof of income, proof of insurance, any of those things to access any of our food programs, including our pantry of choice. If you are uninsured, and there's a little gray area in between for underinsured as well, which is an increasing concern, of course. But if you're uninsured, you're eligible not only for all of our food and grocery programs, our basic needs programs, but also for free primary care healthcare appointments at Hope Clinic, free dental appointments in almost every case. It says maybe eligible. It's to cover our butts on the little occasional times when it doesn't work, but in most cases, dental appointments as well, behavioral health care and counseling, the full spectrum. Oh, yep, there comes the pet. See, I told you. Would you like to see? There he is. Told you that would happen. So the entire spectrum of services, if you are an uninsured person, you can rely on that. Most people come in through our food and basic needs programs and then learn about the wider breadth of services that we have available. That's how most people connect with us. But also, we have people who are Googling, low cost dental care, low cost, cavity filling, and people find us that way. And then are, of course, introduced to the wider spectrum of services that we're able to offer. And people are often surprised that we're able to do this for free. So I will dip in now to just a little overview of each one of our program pillars. You'll notice that our logo has 4 colors in it. These are loosely connected to our 4 main pillars of service. First is medical. This is where we began as a clinic about 40 years ago. And today we're seeing over 3,000 patient visits across both of our sites. Our secondary site is in Wayne County. It is a much smaller building and we are not able to offer all of our services on site at that building. But that integration process means that we can refer people over to our IPSI clinic for things like dental care or for food or for behavioral health care. So we have the same processes and procedures in terms of patient intake over there, and we want to connect patients with those services, but it is a very small building and we can't fit everything in there. We don't have our dental clinic in there. So across both of those sites, IPSI and Wayne, we are seeing over 3,000 patients last year. We filled about 5,700 prescriptions in our on-site pharmacy. And we've seen that really increases good outcomes for our patients because they don't have to go to a pharmacy to fill their prescription. They don't have to take extra time off work or find additional transportation to get there to pick up their prescriptions. In many cases, I think the stat that I heard last was that about 90% of our patients leave their healthcare appointment with the medications that they need before they leave. And that's very important to us to be able to provide that as much as we can. We also have partnerships with Michigan Medicine, IHA, and Trinity for specialty care, as well as radiology and labs. And so when our patients come in for a primary care appointment and something flags that they're going to need some additional diagnostics, some additional specialty care, we have partnerships with these major healthcare systems that enable us to refer our patients to be seen for free and have those needs met for free, which is completely life-changing. As you can imagine, for anyone who's ever gotten an $800 or $900 diagnostics bill of some kind or several $100 lab fee for blood work or whatever, these partnerships are really the bread and butter of how we're able to make a real difference for our patients in the medical arena. We also have a dental clinic on site just down the hall. And so our centralized intake offers people the opportunity to avail themselves of our dental care as well when they come in for a medical appointment. Can't always get you in on the same day, but we'll try if that's something that you want. We understand that it can be difficult for our patient population to access transportation. And so it's important to get as much bang for your buck as you can out of those appointments when people are able to come by. So we do our best as patients want and are able to combine appointments if we can. And last year we've provided $1.7 million worth of dental procedures. And those were procedures that patients did not pay a penny for. That's the value of those services provided. We provided over 10,000 procedures for patients, and that was about 3,700 patient visits in our dental clinic last year. And we're very proud of those numbers because, boy, dental care is expensive in the best of circumstances for people with insurance. And it's just completely almost unapproachable for people who are not privileged to have that kind of insurance. So you can really see the impact in that $1.7 million number. That's money that has stayed in the hands of vulnerable people in our community and not left our community. So we're proud of that. Oh, look at that. I put some stats up that I forgot about. So in medical, we have seen more than 11,000 medical volunteer hours. Our care is being provided largely by volunteers. And in dental, see, I moved the little bar so that I could see my thing, and now I can't see the other one. However many volunteer hours I said is the number of volunteer hours that we have. I've completely snarled up my whole screen over here. Thank you for your patience. What button do I have to push to get it to go back? Okay, maybe that. Okay, more than 1,700 volunteer hours from dental professionals in our community to make that number happen. Alrighty, so our other two pillars of service are our food and basic needs program and our behavioral health program. As I said before, behavioral health is integrated through all of our other services. And so folks are being offered behavioral health care interventions, brief interventions on site for all of their visits if they need them, screenings for every visit. But yes, our food program is by and large, far and away, our program that receives the most engagement with over 72,000 hot meals served. That number is a significant, I'm sure that you guys have also seen significant increases in food need in the community. And we are seeing up from about 75 hot meals served per evening just a couple of years ago now to over 150 each evening that we serve. And that's six nights a week. Not Wednesday. Everyone's always like, which night? Is it Sunday? No, it's Wednesday. It's not Wednesday. It's a little confusing though. Thursday through Tuesday is when we're doing our hot meals. The reason for that is that there used to be another community-based hot meal on Wednesdays, and so we were sharing the week in that way. But unfortunately, that hot meal has closed, and there's now a gap on Wednesdays, in case anyone is wondering where there's a gap that might be filled. Hot meals on Wednesdays. So yeah, last year we did over 72,000 hot meals. We also had pushed 4,500 plus diaper pantry visits. We know how expensive diapers are. We know how expensive formula and other baby care items are. And so over 4,500 visits of families coming to avail themselves of those very expensive services. And we're pleased to be able to alleviate that burden for families to the extent that we can. We also have an on-site laundromat at Hope Clinic. It is a free self-serve service. We have 8 washers and dryers. And so we are running laundry appointments all day, every day. And so last year we provided over 850 free self-serve laundromat visits for people to come and experience the dignity of having clean clothes. We believe in that. We have also had over 8,000 visits at our Choice Food Pantry and our farm stand as well, which is a secondary site. It's right next to our building. And that's where we are, we do sort of a CSA style distribution of fresh produce for that. So moving over into behavioral health, this has been a growing edge for us, as I expressed, moving towards greater integration across all of our services. So our team had over 5,100 visits of a behavioral health nature. That is a broad category because of the diversity of integrating behavioral health throughout all the departments. And so it's a little bit of a chunky statistic. It includes screening, includes interventions, referrals, as well as team-based care with other healthcare professionals. So that's our doctors, that's our dentists, that's if a patient has to be referred out, and we're working with these other healthcare systems, keeping our behavioral health professionals involved with their care. And we are also providing over 2,200 healthcare navigation services. So we want people who are eligible for insurance that is affordable to them to be able to find it. In a lot of cases, we know that's really difficult for people. And so people end up in situations where they feel that they have no options simply because they are maybe not aware of the options that they do have. And so our on-site healthcare navigator helps people connect with those. We also have patient advocacy to help folks who may have difficulty filling out forms or accessing other types of services, to have someone to sit with them and walk them through it. We're very proud of being able to offer those services because we've seen really what a big impact they make on people's ability to stay healthy. So we've seen really great outcomes from our behavioral health integration program, including a 7.5-point improvement in substance use and a 9-point improvement in depression and anxiety. I was not familiar prior to speaking with our behavioral health team really about what these stats mean, but they were able to share with me that these are really impressive numbers based on the scales that they're. Did I just see? Oh, I saw Lauren. Lauren knows stuff. I was gonna say Lauren works at Hope Clinic. She's one of our behavioral healthcare professionals. She probably knows more about this than I do. So just give me a thumbs up if I'm doing it, Lauren. I'm saying right, fantastic. Um, so these were numbers that our behavioral health team were very pleased with, numbers that they felt were surprisingly high, very optimistic, showing positive outcomes of the integrated method for addressing specifically substance use, but also the depression and anxiety numbers. I should never have put all these little transitions into the slides because I don't expect them and then they pop up in my face and I'm improvising. It's good. Alrighty, and so as I previously mentioned, Hope Clinic is driven by volunteers. We have a core staff that provides the training, the guidance, the consistency, the backbone, the basic skeletal structure for the services that we provide in order to be able to ensure a high and consistent quality of services. But the vast majority of our services, particularly in the food and basic needs department, you'll see how the numbers stack up here, but are being provided by volunteers. And so professionals like medical professionals, dental professionals, behavioral health professionals, and some administrative professionals have donated over 16,000 hours of volunteer service last year to Hope Clinic. And average everyday people who are not serving in professional roles have provided over 44,000, almost 45,000 volunteer hours last year. And so we are a diverse and mighty team of caring individuals, not just a few people who believe in seeing things done differently, but truly a wave of people who believe that, you know, if we can't agree on anything else, at least we agree that if you see someone who's hungry, you should feed them, right? If you see someone who's sick, you should take care of them. And so we are very proud to have numbers like these that show the kind of compassion that is in our community, the kind of will and desire to create something different, another way of being a community together. And you can really see that borne out in the numbers. And we are always looking for more volunteers if you're interested. I know you're all very busy with your own busting of barriers in the ways that you do. But the hopeclinic.org/volunteer is a great place to send people who are looking for that meaningful opportunity, whether they're professionals in a clinical capacity or just everyday people looking for an opportunity to get connected. As you can see by the numbers here, got a lot of opportunities to do that. I will mention this as I wrap up here. Each month, if I do a good job at my job, and sometimes I miss it, each month-ish, I'm sending out a really quick partner and referring agency newsletter that always has our most recent menu of services in it. This is a document that changes quarterly. So it's not a huge, you won't expect to see a lot of changes in this document regularly, but it's going to run down to the extent that you can see on here. It's going to run down all the services that we offer and when people can avail themselves of those services. And so this is a great document to print out, to have on hand as you're working with people. I tried to put a little URL on here. Didn't come up. But anyway, the hopeclinic.org/hope-services is where you can find this. It shouldn't be difficult to find if you just go to our website. But I do send this flyer out direct to your inbox if you are on the list to receive it. That way you can just run it off, have a stack on hand, and then you can always let people know when they can avail themselves of our services. That is the extent of my presentation at this time. Thank you to all of you for listening. And I don't know if I have the opportunity to take questions, but I'm willing to. So Stacy, you can let me know.
Yes, definitely. Questions. I have a couple questions too, but I'll let others go first. You may
Great.
unmute or put in the chat. All right, I don't have any questions coming up just yet in chat. Maybe people are working on that.
I can't even
But I had a couple. I had a couple questions if I could jump in. So these are fantastic services, and I'm really glad that you're here to tell us all about them. What would you say is Hope Clinic's capacity? Do you tend to be at capacity? What does it look like as far as, referring people and when they might receive services? So let's say in an example, a medical appointment, how long is the wait for that medical appointment? What's the capacity like?
The truth is, I don't know the answer to that question, but I do know it varies for our departments. And so for our food programs in particular, I know that for some of our more regimented services, like a pantry appointment, we are booking about 3 weeks to a month out on that. I don't know. I would totally offer Lauren the chance to talk if she knew more than I did about this. But I know there's some variation, and I know it does depend a little bit. Since we are volunteer driven, if we experience a disruption with our volunteers, if we have a certain number of healthcare providers and then suddenly we don't, that could affect our ability to see patients in a timely manner. I know there have been occasions during my couple of years working with Hope Clinic where we have had to close to new patients across a few different departments. And so I think the best answer I can give you is that it's variable. It's kind of just the nature of the beast of working with volunteers and in partnership with these other organizations. We, have to take what they're able to give us. But we do our best to, we understand how important it is that it's timely, so.
I would also, if you feel it's appropriate, feel free to take your newsletter if you want and post it on Barrier Busters, the listserv, to put it
Okay.
on the listserv.
I'm not on the listserv, but if you could get me on there, I would like
I
to.
can help you with that. Yes. And then,
Perfect.
and this is information for everybody that if you aren't able to post for whatever reason, you can email it to me and I will forward it on. So whatever works. But yes, I will make sure if you want on it, we'll get you on it.
Fantastic. I'm seeing some questions come up. I'm going to go backwards on the questions because it will be easier for me to answer this second one first. Can you come volunteer and tour? Absolutely. 100%. So I would recommend reaching out. I think you can honestly email tour@thehopeclinic.org. I think. But if that's wrong, you can call our front desk. They will patch you through to the right person. We do tours all the time, multiple a week. We're always happy to have you. And we can often pair up volunteer opportunities with tours together. That's something we do all the time. So we would love to have you. And then I'm seeing a note about Thanksgiving food and Christmas. We do have a Christmas program coming up. It's going to be connected to the appointments that people have on the schedule. So if you're coming in for an appointment at Hope Clinic during the month of December, we will have a Christmas gift for you based on the appointment that you attended. So I'm particularly excited about the medical appointments. We're putting together these little preventive care kits that are very cute. Our team calls them No Flu For You kits. They include things like emergency and hand sanitizer, packs of tissues, chicken soup in there. And so things to keep the winter ick away, but also some things to help if the ick comes and gets you anyway. So depending on which department you have an appointment in during the month of December, you'll be walking with a Christmas gift of some variety that corresponds to the appointment that you had.
I love that. Anybody else have want to unmute?
I have a question, Sheila from Safe House. So I wanted to find out if a person does have insurance, but does not have a primary doctor, if they came to you, would you refer them, since they do have insurance, onward, or can they just stay with Hope Clinic ongoing with their health insurance?
I'm pretty confident. I think Lauren would probably be better to speak to this than I would. Are you in a comfortable position to speak to that, Lauren?
Sure, absolutely. So a lot of times when people call in to become a new patient, they will check on CHAMPS to verify if they do have coverage or not. Generally at that stage, if they verify that there is insurance, they likely won't see them as a new patient, but we do try to connect them on to if they do have insurance, like we'll look at, providers that are accessible to you, especially with like counseling services. We have a list for people that are insured that we can give out. So it does, yeah, they'll usually catch it around that stage when they're doing the intake for new patients. But there is also, that underinsured little gray area that varies, and that medical would be able to talk more on. But to my knowledge, it's usually verified there, and then we either have them become a new patient or we connect them on to providers that, are accessible for their insurance and that sort of thing.
Okay, thank you.
Thanks, Lauren, and thanks, Sheila. Answering the question about medical and incontinence supplies, we have a pretty detailed list on our website. There's a little drop down that says donating stuff on our website that will let you know about, particularly with medical, which supplies we're able to take and what we're not. If we're not able to take it, we also have linked on there a list of other agencies that might be able to take it. And so I would advise you to take a look at that to know what we're able to donate. We are so maxed out at our building. So we have every nook and cranny that we're using, for clinical spaces and stuff. And so our storage is at a real premium. So we're a little bit picky about what we're able to take for donations.
Okay, and as always, I will have these slides available on the Barrier Buster website. So that information will also be on the slides. And then something that we did last month, which I thought was great. Feel free to include, Betsy, if you want to send it, but I can also send your slides to the Barrier Buster listserv directly.
Great.
That would be great. Okay, well, if there's any more questions.
I have a comment. Betsy, you spoke to the day of the week. Oh, my name is Johnny Walker. I'm community engagement at Right Away. You spoke to the only day, Wednesday, that you did not serve hot meals. Just a point of information. Pastor Anna and Fed Up Ministries do serve hot meals on Wednesday at the farmers market. So
Fantastic.
yeah.
Thank you for that. I did not know that, so I appreciate you letting me know.
I
And if
know
I
that
can shout out A Brighter Way as well, you've been one of our guests for our whole person health initiatives, that a little tabling event before some of our meals where we help connect our food clients to some of the resources that are available in the community. So thank you, Johnny, for
Absolutely.
partnering with us in that way.
Absolutely.
And to also add to that, Pastor Anna is actually from Fed Up Ministries, is also, she is scheduled to be a presenter at our in-person session next month in November. So she'll come and tell us about her programs too. So I'm looking forward to that.
I see a hand up from Diana.
Hi, yes. Hi, my name is Diana Don Farm. I appreciate you guys. We go there every third Tuesday. Been going there since 2020, I think. Me and my partner, Don Farm, we work together. We love it. We love the way how you guys treat us, take all our pictures all the time we come, but it's okay. I just want to give you guys a shout out for the warm and welcoming. Right Away be there. A lot of organizations be there setting up with us, we love what we do. So I appreciate it. I just need to say that for you guys. Thank you, Dan, and all you guys.
Yeah, thank you, Diana. It goes both ways. Really, whole person health, that time where we're seeing those agencies like Don Farm partner with us, that's been so impactful. We've seen people walk in the door who are in need of help, and we'll watch that temperature, that thawing go over them, where they're maybe not so sure, but then they're talking to somebody from Don Farm, and then before they leave that evening, they've got an opportunity to connect with services and really get the help that they need. It's been so powerful to have Don Farm partner with us in particular, as well as all the other organizations that we are partnering with. So thank you so much, Diana.
Fantastic. Okay. Well, we know how to reach you. We have questions. And all right, I think then we'll move to our next speaker.
Fantastic. Thanks so much.
Thank you for being here and sharing this. Thank you. I have Sarah. Are you ready, Sarah, to share your screen and your slides with us?
Yes, I sure am.
Okay, so thank you for being here. I'll let you go ahead and take it away.
All right, and I did want to echo Johnny's comment. I'm actually a board member at Fed Up Ministries, and so We have, filled that Wednesday hot meal roll from 5 to 6 p.m. at the Marketplace building for Growing Hope on Washington Street. So love to have you come down for that. But I'm here today to present in my capacity as the Senior Director of Resident and Community Engagement at Habitat for Humanity. You can see here on our screen, our mission statement is to enrich our whole community through a legacy of affordable homeownership for individuals and families of low income. So I wanted to share with you, kind of like Betsy did, our pillars of our programs. We have kind of 4 areas of impact that we serve, and our service area is Washtenaw County for the most part. There are some things that we can kind of move a little bit outside the borders on, but our main flagship program is our homeownership program. I'm going to talk in a minute in more detail about each, but on average, right now we're selling 6 homes to new buyers through the homeownership program. And then we have a very robust home improvement program. Last year we served 922 individuals or households with projects for home repairs. We have a community development department, so we are engaging with community members in 3 partner neighborhoods. And then, of course, we have our Restore, which is kind of like a thrift shop. Anyone can donate or come there and shop and find some goodies. So let's talk first about the home ownership program. Our home ownership program was the first and only program that we did for many, many years. It started in 1989. We sold our first house in 1990. And it is a way that folks who might not be able to access buying a home in the conventional market can become homeowners. It's about a 6-month process right now. And really the way it works is we would partner with a buyer for a specific house, and that house is then sold to the buyer. We have partnerships with local banks that have below market interest rate products, so you're able to kind of take advantage of a lower market rate for a mortgage. And your income for that program is between 30 and 80% of area median income. I've got a chart in a minute that'll show you some numbers. Some things that people don't always know is we do partner with Housing Choice Voucher organizations. So if you have a client who is receiving Section 8 on a rental voucher, that can be converted to a home ownership voucher, and that voucher can help pay their mortgage. It can pay it for up to the life of the loan if they're disabled, or the first 15 years if they're not a disabled individual. So that is something that people don't always think of as income, but it is something that can be used towards the program. And then the other piece that a lot of people think of with Habitat is, we're building the house, you're in there with the volunteers, you're actually swinging a hammer. So that is a requirement that 75 hours are contributed in actual construction time, as well as home buyer preparedness classes. Those are things like financial education, credit repair, some home maintenance courses. So a little bit of things to just, get you in the mode to be a homeowner, because the majority of our families and individuals are first-time home buyers. Not everybody, but the majority. How the process works is, like I said, we finance the loan with our banking partners, and we also have access to several down payment assistance sources. So right now, if you've been hearing about the market or looking at the market at all, you know that housing prices are pretty steep. And our houses are either brand new, so built from the ground up, or 100% totally renovated. So they are like a brand new home. Our appraised values right now are coming in between $200,000 and $250,000, which seems out of reach for a lot of people. You might think, gosh, there's no way I can afford that. What I would say is don't count yourself out or your client out. We can partner them up with MSHDA Federal Home Loan Bank, some local bank providers who give down payment assistance. And our last buyers got about $56,000 in DPA. So it cuts that price of the home, you know, right off the top by the amount of the down payment assistance, and helps that mortgage become a more affordable price for the buyer. And then the rest of that mortgage is financed by our partner banks. We do guarantee that the home buyer's payment will be no more than 30% of their income, which is kind of an industry standard as a definition of an affordable payment. With that, I will say that, you know, your best bet is to have somebody talk with our lender or our lender and staff. Her name is Elena. She's the person that can talk with you if you have a specific case or a specific situation, or someone who might be interested in buying a home, and she can share with you, you know, the details that they'll need to really understand. On this screen, we've got our most recent house here at 399 Elder Street. That house is actually available right now. We're looking for a buyer for that home. We have a home, we have an application period, and it is open right now. It actually closes today, but if we don't have to get a qualified buyer, we'll reopen the application period. So again, don't wait for an application period to be open. If you have somebody interested in owning a home with us, just have them call Elena, talk through their specific situation. She can tell them, you know, kind of what's on the horizon for the timeline for the next homes, and she can talk to them about their specific income and their specific credit situation. On the right is our bare necessities criteria. So need for housing is pretty broad. You know, if you can't afford a mortgage, you're pretty much, you know, in for that need. Willingness to partner means you're willing to contribute in that volunteer time with us and attend classes. The ability to pay for the mortgage is something then that Elena would talk with you about with your specific situation. And you have to have U.S. residency or permanent residency status, or there are some eligible immigration statuses. And you can't already have a home. You can't be a homeowner currently and then also buy a second house through us. And the last one, if you have had a bankruptcy, it does have to have been discharged for 2 years. Our lending partners are still underwriters, and they do have some criteria that they need to follow, and the bankruptcy one is one. So that is kind of in a nutshell our home ownership program. Our next program is our home improvement program. And this program is available in a variety of different ways. I will say, you know, to the question that was asked first on the last one is, you know, how likely is it for people to get enrolled, and how long is the waiting list? For our home improvement program, it is unfortunately entirely dependent on funding availability. So throughout the year, we get various grants, various funding sources. And so at any given day, a program might be open, it might be closed. So I always tell people your best bet is to give Martha a call. Her number is up here on this page, and just ask, you know, what is open right now. I will say the DTE funded programs are closed until January of next year. DTE allocation funding was all spent, and therefore there is no funding for those programs right now. All indications say that they will reopen, though, in late December for early January. Critical home repair, again, we have some programs that are open right now for that. And our veteran home repair is the one that's almost always open. There's a pretty steady funding source for repairs for homes that are either owned by a veteran or a veteran lives in the home. So if you have any clients in that situation that need repairs, definitely give Martha a call and she can help you out with that. Some programs do get tied to specific zip code regions or types of repairs again, so always best to call Martha. She'll let you know, answering a few questions, give you an idea of what's available. And on that last one, let me just say there is no cost for our home repair program other than a $20 program application or program participation fee. So these repairs are all no cost to the homeowners. Our other kind of pillar is our community engagement work. And so since 2012, we've been working with the West Willow, the Sugar Brook, and the Galt Village neighborhoods, offering, you know, home improvements, offering our home ownership programs, but also then partnering with residents on neighborhood-led initiatives. So I just wanted to highlight, you know, kind of what that has looked like over the years. Priorities that we often hear from residents that they want to work on together are strengthening relationships amongst each other, enhancing amenities in their community, improving health, youth opportunities, racial justice, and asset preservation. So if you have clients in West Willow, Sugar Brook, or Galt Village, you can have them reach out to me and we can kind of connect them to things that are going on. These are not programs that we're leading necessarily, but we are bolstering up, supporting, and helping the residents who are wanting to see this work done, helping them just, you know, have the leadership and the capacity and funding in some cases to carry out initiatives that are important to their neighborhood. So sometimes those things are like movie night. So this Friday in Sugar Brook, there's a free family movie night that we're helping the Community Family Life Center sponsor. So if you have any clients, anyone can come to this. We did target a mailing to the Sugar Brook neighborhood, but the kids chose Monster House, which I understand is a fun but not too scary movie. So I'm excited to see that. Starts at 6:30, but you can come at 6 and get some free pizza, popcorn, and snacks. Something we did last weekend was a West Willow Dumpster Day, so partnering with community members in West Willow for a day when residents can just bring things and get rid of them in dumpsters. That's an annual event that we've done for about 6 years. It's always a big hit. We are still working with the West Willow residents on a racially restrictive covenant repeal. There's about 400 homes in West Willow that have a covenant from when the land was originally subdivided that says nobody other than those wholly of the Caucasian race can live or occupy these homes. Of course, that is illegal and unenforceable today, but the language still exists. So we're partnering with the community members to go through the process to gather enough signatures to actually change the wording so that when people buy a home and they see that document, they know that there's been an active group of folks who have come together to make it change. And then on asset preservation, we have been working with Legal Services of South Central Michigan and Legal Aid and the Washtenaw County Bar Association to put together a program where you can sign a very simple estate planning tool called a Ladybird deed that will pass the ownership of your house to a named beneficiary, kind of like you do on a retirement account or a bank account. So that's in a pilot program right now, and we've piloted with our homeowners right now with Habitat homeowners, but it is something we hope to be rolling out to the larger general population probably over the next 12 months. This is just a map of our partner communities. On the left is all of our homeowners, so people who bought a home through Habitat, and then on the right is everyone who's had a repair to their houses in West Willow, Sugar Brook, Galt Village. So just kind of shows you like a little impact heat map. And then I would certainly be remiss if I didn't talk about the Restore. So if anyone hasn't visited the Restore, it is on Jackson Road right next to Menards, and it is open Tuesday through Saturday from 10 to 6, and it's, you know, just a giant warehouse of building material, furniture, appliances, knickknacks, household items. When people ask, what do you take for donations, I pretty much say anything but no toys and no clothes. Other than that, definitely want to call and just ask if it's an item you're unsure of. But this, you know, is a great opportunity for people to get rid of items instead of them going into landfills, but also purchasing things at low cost. We have just started on our Facebook page a online store. So they're posting some very kind of niche-y items for sale online through the Restore now. And it's just started within the last month. So it's getting ramped up, but we're testing it out and getting our inventory process straightened out. But hopefully there'll be more opportunity to shop 24/7. And then another thing people may not know about Habitat is that we have a commitment to international homeownership. So every Habitat in the United States is asked to tithe a portion of their donations to international building. And so we support building in Guatemala. We have a strong partnership with Habitat Guatemala. So we have spent not only cash and funds there for every house we build here, we fund a house to be built in Guatemala each year. And then we have done 8 actual mission trips there with staff, friends, community members to build homes. We're planning our next trip in April of next year. So if anyone is interested, I'll be team leader. Definitely reach out. I can get you some more information on that. But that's just another piece of our support. And like Betsy said, and you know, a lot of us rely on volunteers very heavily. So, you know, thousands of volunteers come out each year to support Habitat, either in our Restore. We have volunteers every day that the store is open, building the homes alongside the home buyers, our neighborhood beautification events that we do. We offer court-ordered community service hours. Most of our opportunities are for 18 and older, but we do have some opportunities for 14 and up. And Mariah is our volunteer coordinator. She'd be happy to talk to you about either individual volunteering, or if you want to have a team come out from your organization or your church, or just a group of friends. We've had like bachelor party people come out and support us. Just, you know, get your friends together. She can connect you to our team to talk about volunteering. That is all on my official presentation, so I would be happy to entertain any questions. I think I saw some in the chat. Let me try and get to the chat.
Yeah, thank you, Sarah. That was great. Yeah, please, anybody want to unmute, have questions? Sheila, I think, is your hand up?
Yes.
Hi, Sheila.
Hey, Sarah. I love Habitat, and I'm one of those homeowner recipients. 4.5 years out, my home will be paid for. So I
Yay.
love, 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 love Habitat. So thank you, Sarah. So yeah, I want to give a shout out to you all. But I
Thank
did
you.
have a question for a senior. If they just had a medical crisis and just got out of the hospital, but need like bars and rails, does the home improvement program help with that?
It will. It's, again, kind of dependent on the time of year and what funding we have available. But yes, we have programs for that, as well as I saw someone's question there about ramps. That yes, those are also eligible for home improvement. But again, just dependent on what's going on in the funding landscape at the time that you call. But definitely.
All right. Thank you, and good to see you.
Nice to see you, Sheila. Yeah, I worked in a different area at Habitat. When Sheila bought her home, I was in our home ownership program, so we worked very closely together. Carrie, your hand is up.
Hi. Yeah, so
Hi.
I'm with a friend now, Veronica, who she's battling metastatic breast cancer. We had been in correspondence with you guys, and I was curious about her daughter who lives with her had gotten a job, and then once she gets her Social Security, I believe she'd be eligible. But in an event like this, can people get co-signers? And is there any sort of disability allowance that you guys have as far as different requirements for through the ADA or anything like that?
And so you're talking about owning the home ownership program and purchasing a home?
Yes.
Okay, so there is no definition of family as to who can apply to purchase the house. So we have had generations, be buyers together. We have had unrelated parties be buyers together. So that is up to the people coming forward to us to define who they want to be on the purchase agreement and actually on the deed to the home. I don't know on the ADA about like assistance for funding necessarily, but we can, build or renovate the home to allow for somebody that has needs. But I'd be interested to hear maybe more in a conversation offline about what you're thinking on the financial assistance side of things. I don't know that there's anything directly there.
Yeah, I don't think it is through financial. I do know, and maybe this touches on the last question that was asked too, that we've been looking at a ton of different resources and like reasonable accommodations and things like that. And a ramp and wheelchair ramps are some that can be, reasonable accommodations through different agencies and things like that that can likely help with payment for that. So just to touch on that last question.
Yeah.
But I do think that, it's been very interesting, like learning about MISHDA and the non-elderly disability voucher thing, so we're on a list for that
Okay.
now. And as you said, those can be used toward as well, correct?
I would assume so. I've not heard that specific voucher. We have used the homeownership choice voucher and the VASH, which is a veteran voucher before. So
Yeah.
if this is like a specific special purpose voucher, I would think it would work the same way, but definitely talk to Elena.
Okay. All right.
She'll investigate it with MISHDA. And on the kind of building or the house itself, you may have noticed on that last one, where all of our new builds are visitable. So that means there's a 0-step entrance and wider doorways and, turning radius in the bathrooms. They can be made accessible, if a client has that need as well.
Okay. Thank you so much.
Yeah, thank
Yeah.
you. I see Yoon Lee's question about the Restore. Unfortunately, we don't have any voucher programs for shopping there. It's just come and hopefully find something that's, in your budget.
This is
Are your
great
VA programs
information.
county dependent? Beverly, yes. So we are, for the home improvement program for veterans, they do have to live in Washtenaw County to be eligible for that program.
This is all great information. Any more questions?
Kendra, your hand is up.
So is there like a referral process for like if you have one that's like wanting the home ownership or anything like that, is there a referral process, or do we just give like the families the information?
Yes, I would suggest just directly having them call. We're going to have to ask some pretty specific questions to find out eligibility, and they would need to be the ones that are on the conversation to give that information out to get the best answers. So when I send the slides out, there will be, my contact on the front page, and then Martha and Elena's contact on those slides for the home improvement and the home ownership program.
All right, thank you so much.
Yeah, you're welcome. Beverly, do we have a chapter in Monroe County for veterans? I don't know if there is a Monroe County Habitat for Humanity. We all operate 100% independently, so we are our own 501c3s. We do some networking and kind of regional conversations, but we don't all offer the same programs or services. If you Google Habitat Monroe, you'll certainly come up with their phone number and could give them a call and see if they have a repair program for veterans, but I don't know for sure if they do. All right. Any more?
Unsubmitted questions? And the same thing for you, Sarah. Your slides I'll have available on our Barrier Buster website. I will, you may, or I can also add them to the listserv. And if you have any program, are you on the listserv? Do you receive?
I am on the list. Yeah,
Okay,
I can
great.
send our slides out because I made a tweak to the
Okay.
version I sent you.
Okay,
Small change, but
great.
it's a better
So
phone
as-
number. So
Perfect.
Yeah.
That's important.
Yes.
So anytime you have any updates or anything that you would like to share with us, like I really liked the idea of this, the one that you're co-hosting with, the movie night.
Mhm.
As we all interact with our community members, when you hear somebody's in that area, it would be nice to say, hey, did you know that there's this event happening?
Yeah.
Bring community together. So anyway, events like that I think are nice to share too on the listserv. So
Great
feel
idea.
free to put that flyer out there for all of us
Okay.
to see.
I'll definitely do that. Thank you for having me.
Yeah, thanks for coming and sharing. This has been very, very enriching to know what's out there. Okay, I'm going to go ahead and move us. I'm going to share my screen and move us into just the little Barrier Busters update. Okay. So this is what we got. There's really no changes. No, I say this every time. Okay, so this is what we have. We're coming to the end of the year, and so our funding is starting to decrease. We do have our monthly allocation of the 14.5 for Washtenaw County for all of the residents, and then our more specific funding, Ypsi Township Fund, we have that available, and Pittsfield Township funding. Our skip funds are starting to decrease, so we don't have that have much in the way of that right now, but there is still available funding. If you need any more information on the specifics of accessing the skip fund for those that are 60 and up in our community, you would want to go and maybe either go to Housing Bureau for Seniors. I believe they have information maybe on their website to at least contact their staff to get some more information. I've also sent through the listserv some information. I think if you just search in the email skip funds, you might find that more information on that. You're also welcome to reach out to me and I can also share. But that's going to wrap up probably in the next month or so. We always have ongoing Ann Arbor H2O water utility funds available. So if you have a City of Ann Arbor resident who needs assistance, reach out to me. Let's get a request in and we can support that. We do have the Board of Commissioners has allocated some housing funds for Barrier Busters. That is for their winter task force, sheltering task force for this winter, that initiative. And to access our Barrier Buster housing funds, remember that all of those housing funds, or to access, needs to go through HAWC and the SOS pipeline. So if you have any questions, you're welcome to reach out to me or have your client contact HAWC. I heard last week that they are scheduling up to 24 or a business day away. I think there was even a couple of appointments that were happening same day. So it's moving smoothly. So there shouldn't be long delays as maybe there once was some time ago. So encourage your clients right now to go ahead and contact HAWC to find out if they can get funding or assistance with their housing. My next is pretty much next month we'll have an in-person. I am getting really excited. I hope to see many of you there. I'll have refreshments for us. It'll be live or in person live. And I will also have the Zoom available. So if it is easier for you to access our meetings on Zoom, please, we will definitely have that. But we're hoping to have as many in person to do that networking and kind of connect with all of us, all of the colleagues in our social service network. Okay, any questions I can answer in regards to Barrier Busters? Anything on funding? If you have your hand up, let's see, I'm not able to see the way I have it set up, I'm not able to see anyone. So please feel free to unmute or put in the chat if you have any questions.
Location again of November 19th meeting. Well, I think I caught Learning Library.
Hi, Angela, is that who?
Yes.
To ask me that again, what I'm sorry, you were kind of cutting out and I missed what you were asking.
The location for the next meeting, the in-person meeting, November 19th.
Oh my goodness, I really want to hear you, but I missed what you said. One more time.
The location of the next meeting, the address, and I put it right. That's
yeah.
135 Washtenaw Avenue, 48108.
Thank you. Thank you so much.
Thank you. I apologize for not being able to hear you. I don't know. It could very well be my computer. Yes, I will be sending out information on where it's going to be located at the Learning Community or Learning Resource Center, the LRC for Washtenaw County, a county building.
Okay, got it.
So I will definitely make sure that I get all of that sent out. I'll probably be doing it really soon because that meeting's coming up. So stay tuned. And then of course, reach out to me if anybody missed the address or needs the information at any time, let me know. I'll make sure I get it to you. Thank you, Christine, for putting that address in there. Fantastic.
Of course, I was adding it to my calendar, so that way I can make sure to attend it on time next time. So
perfect. Thank you. Thank you. I'll send out meeting invites again for that in person, as well as a Zoom. So maybe we'll see. I'll have it set up and we'll see. Make sure we clarify which one people can attend, their preference for attending. Okay, well, I am done with my Barrier Busters update. So I can wish all of you a really good rest of the month and enjoy fall. If I will stick around right now. So if anyone has questions they want to talk to me, if they have a case that they want to discuss, anything, I will stay on the line until everybody has left the call in case anyone wants to ask anything. So have a great rest of your day and nice fall. Thank you, everyone.
Thanks, Stacy.
Yeah, thank you.
Hi, Stacy. I just wanted to follow up on questions to changes to SCIP funding.
Mm-hmm.
What do you foresee coming up?
To replace SCIP or to fill that space for seniors?
Yes.
So my guess, and this is just my guess right now. So my guess is that when the next for 2026, my expectation right now, and I don't have confirmation of this, so I could be wrong, but it is my expectation that the Board of Commissioners or the new Director of Aging will have a new SCIP amount, like a whole new for the next year, specifically like SCIP funds for our population 60 and up who need assistance. And it'll probably look maybe it'll look just like it is now. If there are changes, we will definitely communicate that. Whenever those